Hey, what's going on, everybody? I just had an artificial disc replacement in my C6 and C7 between those two discs. And I want to tell you the kind of the history of the issues I had leading up to it, the horror story with insurance, how surgery was, and I'm on day 3 right now. So if you want to subscribe, I'll try to update every few days on how recovery's going. And let's get into it. So to start off, about a year ago, I was having pain between my shoulder blades, so it hurt to turn over in the bed. So I didn't really think much of it. I thought maybe I pulled something. I looked on YouTube for some stretches, trying to figure out how to make it better, but it never went away. And then I was doing some chin-ups and stuff, just trying to stretch out my back. And then the next day, I had extreme pain running down this arm, my right arm, and these 3 fingers were numb, at least this much of it. So then I went to the orthopedic doctor. They took some x-rays of my neck, and they said my neck looked horrible, the C5 to 6 and 6 to 7. So I had 2 bad discs. So they referred me to a neurosurgeon, and I went there and they took x-rays, said, yeah, it's bad, need to get an MRI. Did that, said I needed 2 discs put in. And that's when the issue with the insurance company come up. So the insurance company wouldn't pay for anything. I had Cigna, and they said, no, just go to physical therapy, which I tried physical therapy for several weeks. That's what the orthopedic doctor sent me to. Did that. He put me on several medications, gave me some steroid shots. None of that helped. So I went through all those steps that the insurance wants you to do, and they still wouldn't approve my surgery for the 2 discs. So after several appeals and all that, they approved me for 1 disc. I picked the worst one of the 2. And that was 3 days ago. That was on Monday I had surgery. All right, so surgery was 2 days ago, which was Monday. I went in for noon at 12 o'clock. Surgery was at 2. Surgery lasted about maybe an hour and a half, I guess. No issues coming out. Had me on all the pain meds and all that kind of stuff. But I never had any pain, even though I was on pain meds and they gave me muscle relaxers and all that too. But normally when you're coming out of it, when you get to that 6-hour mark, you can kind of start feeling pain and you needed more pain meds, but I never had that. So I had to stay overnight in the hospital because I had a drain tube coming out of my neck to a little bag. Because I needed to pull that drain tube and all that out the next day. And they did blood work and all that kind of stuff as well. But, so the next day, Tuesday, at 10 a.m., they discharged me. They gave me a soft collar to wear, which they said, wear it if you want. So I wore it on the way home, just in case I had to slam on brakes or anything. It just would make it a little more comfortable. And they gave me some medicine. Let's see, they gave me Mobic. I have to take Mobic every day for 6 weeks. And they said, you can't skip that one because that's gonna help something not fuse together. I don't know what. They gave me Robaxin, which is a muscle relaxer, and they gave me oxycodone acetaminophen, which I don't need. I don't need the muscle relaxer or the pain med, so I just have that. So I have to take the Mobic. I don't know if I tell you what kind of disc. I don't know the name brand of the disc. I'm gonna find that out in 2 weeks because when I went, it was gonna be one type. Then they sent me a letter saying they changed to a different type of disc, so I'll find that out. But I didn't have the fusion. All they did was the artificial disc replacement, where they take the old disc out and put the new disc in. So I have the full range of motion, and I can do the full range right now. I don't want to do it because this what they put on is like tape, a sheet of tape over this gauze, which I think I'm gonna take it off tomorrow because my head was down when they put it on, so now it's so tight when I raise my head up. So that's kind of really the only issue I have is this bandage is too tight. And they said it's a small scar, so I'm gonna probably take this off tomorrow, change the bandage and put a new one on. And so that's kind of where I'm at now. But I bought a pillow that the doctor recommended. I'll show you that. So you have to sleep on your back at night because it hurts to sleep any other way. And this is called a cervical neck pillow. It's really cheap. Got it on Amazon. I'll put a link below if I can find the one that I bought. It helps keep your neck at the right angles, which I'm gonna probably keep this and use it all the time because it keeps your head perfect. So I like this pillow a good bit. So no pain, no issues. Everything's going great. The pain in my back went away like the next day after surgery. And these fingers that was constantly numb, I'm down to like maybe one little spot on my fingertip that's still kind of tingly. And that's with them leaving the other bad disc in. So I was hoping that I wouldn't have to get the other disc, but it looks like the one bad one is gonna fix all my issues. So if you like this, you wanna follow along, I'll post a video maybe every few days, just kind of letting you know the update of what it's like getting artificial disc replacement surgery. And I'll see you in the next video.